Good morning. This is Steve Stites, Chief Medical Officer here at the University of Kansas Health System. Delighted, again, to be back with you on this now gorgeous, what day of the week is it? Wednesday morning.
Wednesday.
Here, broadcasting live with you from the Dolph Simons Family Studio, and we have another wonderful program. This morning, we are joined by Dr. Gary Morse, the founder of the COVID Care Force. I like that turn of phrase, the COVID Care Force. He's here to offer his international as well as his regional perspective from a year of fighting the pandemic on multiple different front lines for vulnerable populations. He has great stories for us, including what we can learn from the Navajo and Chickasaw nations. But first, Hawkeye, how are you?
Yeah, numbers.
Well, numbers.
You know, the numbers, the acute infections are down a little bit. I think we had 13 yesterday. 10 active or acute infections today, with 6 in the ICU and 3 on the ventilator. Still 10 in that recovery period. And then Hayes has 4 total, and those are all 4 active acute infections as well.
So we've leveled off a little bit. And the running 7-day average for the United States has not gone up over the last. So that's some good news.
That's some good news. It has gone to, I think it was, mid to low 60,000 running 7-day average. It was about, I think, 71,000 a few days ago. But in Kansas City, though, we see a little bit different trend. It's kind of creeping up a little bit, and that's my concern as well.
Yeah, and we know that young people are now showing up more and more with this multi-system inflammatory syndrome, even if they were asymptomatic at the time of infection. I think there's an article out about that today.
Yeah, so I mean, it just goes to show that young people, although do have less severe infections, but they still can spread it, and they still can get significant disease. And if it is one of your loved ones, one of your children or grandchildren, then it's bad.
And the long haul story is sort of the same one. You may be asymptomatic with the infection, but you can still end up in the long haul clinic. What does that tell us you should do?
You know, the best way to get out of this is vaccination. You know, vaccination can improve that and decrease that risk overall of the whole spectrum of disease, but also those persistent or long haul symptoms as well.
And we're all getting extra vaccine. We've done over, and we're going to talk about these numbers again and again, but we've done over 70,000 vaccinations, but currently we have 12,000 vaccines that are crying in a closet, very cold closet, waiting on an arm to be given to, and that number concerns me.
Yeah, it's way too many. We need people to get these vaccines. Right now, again, we're only giving the mRNA vaccines. The Johnson & Johnson is still on pause. So we know that these vaccines also have very good efficacy against the variants that are circulating, the prevalent variants, including the UK variant and the South African variant as well.
Yeah, that is incredibly important. So we want to twist some arms to be able to get some arms to be able to give some of that vaccine. Let's see if there are any reporter questions this morning. I'm not hearing any, so we're going to turn to Dr. Morris. Okay. The COVID Care Force. That sounds like something from Star Trek or Star Wars. You know, I'm a Trekkie, I guess, but it sounds like some very futuristic kind of cool thing. So talk to us about what it is.
Well, I'm a doctor. I do emergency medicine, and I was one of the co-founders of Heart to Heart International. So I've been involved in volunteer work for most of my life and responding to disasters and people in need all over the world. And when COVID hit, I had the opportunity to lead a team of Heart-to-Heart volunteers, and we went to New York City with International Medical Corps, and it was while I was there that I got a call from one of the tribal council members from the Navajo Nation. Reached out to me, I don't know how he got my number, and said, we need help. We're dying here, our elders are dying, it's terrible. Yeah. Can you send PPE? You know, we need everything, doctors, nurses. And I thought, you know, this is the time to be all in. I mean, we all know, just think what you've been through over the last year. So I decided I'm going to start a whole new program, a whole new effort, and incorporated COVID Care Force as a not-for-profit, and immediately sent a team to the Navajo Nation to assess the situation, public health professionals and doctors and nurses. And we have been there. We have had doctors and nurses there continuously every day since last year for a year now. So, and then other Indian reservations, other tribal leaders called us. I went up to Montana to the Crows, working with the Chickasaws in Oklahoma, been there continuously again with nurses and doctors, paramedics, and we've done everything from working ERs and med-surg floors to testing lines, and of course now, as you say, vaccinations is a big thing. So we're working hard to vaccinate these members of these Indian tribes.
So, Dr. Marsh, you have a big heart, which is just to be commended. So thank you for the great work you and your team have done. And you've traveled the globe during this pandemic.
I have.
Give us a sense of what you've seen.
Well, of course, I've been all over working with various groups. Not only do we provide volunteers, but we also have public health volunteers and myself. We consult with various groups, homeless shelters, soup kitchens, various ministries around the country, from New York City to San Francisco, from the north to the south, and then throughout Mexico. We've been working in Mexico now for the last year, and we have volunteers in Mexico as well. So we have sent out 75 medical teams to 30 different sites around North America and South America, and we have now treated, believe it or not, we have about 1,400 volunteers who've registered with us, but we have treated 250,000 patients over the last year. I mean, we have been on the front lines. You can see our volunteers. They're in an ICU. This is at a civilian hospital in Gallup. We've also worked in Colorado at some of our large community hospitals. So wherever there's a hot spot, we've tried to respond with volunteers, and our volunteers have come out and done a great job with us. So it's been I'm thankful for the generosity of people, both their time and their money.
And their spirit, right?
And their spirit.
I've heard the work, and you mentioned just a moment ago about the Navajo Nation. The Navajo and Chickasaw nations has been really remarkable. What can we learn from that example? Tell us some of the stories.
There's a lot to learn. You know, when I was first called, as we all know, the Navajos had the highest rate of COVID in the country. The incidence was higher than any place, and they had the highest death rate. In fact, when they called me, they said our elders are dying, and the elders are the ones that carry the language and the stories. And they said, we're losing this generation, and please help us. And so I met with their tribal chief, President Jonathan Nez, and we were part of working out, helping develop strategies and mitigation strategies. But the one I can tell you, it's completely flip-flopped. The Navajos now are a great example to us of how you get this COVID pandemic under control, because once they realized what was wrong, and it was March 17th that they had their first case in a little village. And the Navajo people are very communal. They come together on Sundays at church. They eat together. They live in large multi-generational households. And so, they spread it. And they didn't know what it was. They called it the big flu or the big cough. That's how they translated it in their language and described it. Then they learned it was COVID. And it was brought in by an outside person, a substitute teacher in one of the Indian schools. And so once they realized what it was, the president and the tribal council, the Indian Health Service, they really worked hard. And the first thing they did was to establish very strong policies of mandatory masking and then lockdowns, where in the evenings or on the weekends, the tribe just shut down, the reservation shut down. And literally, people stayed home. It was a stay-at-home order. Now, the reason it worked is because the Navajo people respect their leaders. They respect their community. As President Nez says, it's all about the greater good. It's not what is my right, what do I want to do. It's no, I need to do this for my people, for my tribe, for my community. And so people respect their elders, and they saw their elders dying. So when they were asked to wear masks, they wore masks. When they were asked to stay at home, they stayed at home. And when they were asked to get vaccinated, they got vaccinated. So the Navajo Nation now, it is the largest reservation in the United States, 375,000 members. Half of all of them, from children to adults, half of all of them have been vaccinated. And today, I'm just proud to say, this is day 10 for the Navajos with 0 deaths from COVID. They have stopped COVID on their reservation. So kudos to them.
Yeah, that is great. That is great news. And Do you think you'll be able to get the other half, or is there vaccine hesitancy you're trying to work through as well?
They'll continue to vaccinate, and it's children. So when we talk about half of the tribe, it's 16 years of age and older. So as the vaccines roll out for children, of course, I think they'll be vaccinating many more. So in time, they'll get to herd immunity before the rest of the country will, which is great for them.
That is awesome. So where's the COVID care force now? I mean, we're still in the midst of the pandemic. There's hot spots in Michigan, Pennsylvania, and other places and across the globe. So where are you all right now?
Well, right now I'm still traveling to various sites around the country and helping continue to help them encourage vaccinations. I'm going to do a Zoom call with a group in the Philippines here later this week because there are a lot of people, a lot of populations that are hesitant on the vaccine. So we continue to beat the drum for that as you do. But we have people on the ground in the Chickasaw Nation in Oklahoma. We have people on the ground in New Mexico and Arizona with the Navajos. We have people in Tijuana, Mexico today working there. So we continue to send out volunteers. But the newest thing is, of course, with vaccination programs. So even though we've been traveling all over the place sending volunteers, we were called here in our own community. And so last week, we organized volunteers to help vaccinate at a mass vaccination event in Lee Summit. Grandview, the fire chief has called us there. We will be helping them with volunteers. The Olathe Public Schools, as you know, the public schools are starting to vaccinate students, and so we've been asked to help with volunteers there. So we're recruiting volunteers, asking for people to call us. We have a website, which you'll see, and so we're working right here in our own communities as well.
So as you look across the globe and all the places you've been, what do you think has been the most difficult situation you've seen with regard to COVID-19?
Well, that's a great question. I'm a former military, retired military as a reservist. I was a ER doc in the Army Reserves, and I was mobilized 3 times into combat zones, including Iraq, and I've seen the worst of the worst, the mass casualties of wounded and soldiers, dying soldiers. And so, but when in New York City, when they were hit it was a year ago that we were in New York City, it was like a scene from a war zone. I mean, the ERs, the hallways are full of patients stacked several deep, hardly enough oxygen. Sometimes the oxygen would run out. Just more patients, more needs, and than we could keep up with. And so that was probably the worst I've ever seen. But the saddest is probably our Native American tribes. There's 575 Indian tribes in the United States, the Navajos being the largest in land, the Cherokees being the largest in population, but they got hit hard, and their cultures are already vulnerable. They had great needs before COVID hit. They were short on staff and medicines and supplies. The Navajos, for instance, 40% of the Navajos have no running water. So when you talk about hand washing, so they were frightened. They thought, the Navajos, President Nez and the tribal council thought they might lose their nation, their culture with this pandemic. And so that was a sad thing to see. But we jumped in with them and others. And again, it's a great success story for many of our Native American communities because they've got this under control. So get vaccinated.
Well, that is the best part of that story, isn't it? So well, congratulations and thank you, Dr. Morris, for the great work you've done. To think that you started Heart to Heart, now the COVID Care Force, that's a pretty remarkable story. How do people volunteer?
Well, we have a website, and it's you can see it here, covidcareforce.org. And if you'll go to that website, you can volunteer, you can get more information, sign up for newsletters, of course, make a donation. So we do cover the expenses of our volunteers wherever they go. So, but we need, right now, we're looking for vaccinators, people, both medical and non-medical. You need non-medical people, of course, in these vaccination events to help control traffic and various things. So we need medical and non-medical to help us right here in our own Kansas City community.
And how's Heart to Heart doing in the midst of the COVID care?
Heart to Heart has done a great job, and I'm proud of them. And they have been sending PPE out all over to all 50 states, countries all over the world. They've developed several training programs. for healthcare workers, informational programs for the general public, and now they're doing their own mass vaccination events at Heart to Heart. I think this Saturday people can go online and sign up and be vaccinated. So, as you keep saying, the key is getting vaccinated. And I understand people's hesitancy, but, if you think about it from our Native American side, they have the same concerns and questions and worries. Is it safe? And is there a long-term? But they also know, this is the best way. I need to take that chance and risk. I need to stick my neck out or stick my arm out and go ahead and get this vaccine, because if it'll save my family's life or the community or the elders in my community, the elderly, then I'm going to do it. And that's what we have to do. We just have to say, there may be risks. We don't think there are, but you know what? It's for the common good. It's for the community, and let's do it.
So you started Heart to Heart, COVID Care Force. It sounds like you've got a new one called Arm to Arm. My arm to your arm. I like that. That's good stuff.
Yeah.
Hawkeye, this is just great work.
Yeah, I think it's important, to understand, just like you said, they respect their leaders. They understand, although we have tried to save our most vulnerable populations in their nursing homes, they're trying to save their elders. It's a little known fact that it was the elders that helped first identify even hantavirus infection, which is another virus that infects the lungs, because the elders knew decades before that when there were rains, the mouse population increased. So they helped draw that link to allopathic medicine to identify this viral cause of this severe viral disease that affects people in that Four Corners area. And I think it was the Navajo Nation. But I think it's just important to know that as a culture, they understand and continue to want to do what is the best for our full community. And I think that's something that we can all take to heart.
All right. Well, Jill, this has been a great conversation, but let's turn now to the community and let's find out what questions might be out there.
Yeah, we do have a couple of questions for you off the top. And Cindy wants to know about the volunteering. She wants to know, are there age restrictions? If it's do you have local opportunities to volunteer? And if not, how long are the assignments whenever you travel? And are you even able to travel internationally now?
Yes, well,
lot of questions.
Right. Yes. So there are opportunities for volunteers, no doubt, and to go to our website, and that'll give you the information, and you can register right there, and then we'll follow up with you. You'll hear from us. Don't worry. There are opportunities to continue to work in our Native American communities. Right now, they're looking for RNs in particular. Nurses are the greatest need, I think, throughout the whole pandemic. It's the nurses who have borne the brunt of this pandemic and caring for patients. So RNs and LPNs and CNAs, certified nursing assistants, are needed. We also use paramedics and medics because they can give vaccinations. The assignments are minimum of 2 weeks. We cover all expenses, but many of our volunteers will stay for a month or longer. And many volunteers come back and repeat and volunteer again. So if you're available, if you're a medical healthcare professional, and that can be physical therapy, respiratory therapy as well, of course doctors, MDs, DOs, physician assistants, nurse practitioners, all of the spectrum of healthcare professionals can volunteer, and they would go for a minimum of 2 weeks. Local opportunities are for healthcare professionals, but also for non-medical people. So is there an age restriction? No. If you can be on your feet for 6 to 8 hours and help carry clipboards or direct traffic or monitor patients after they get their vaccine, we can use you. So there's no test. So just go to our website, and we would love to have local volunteers right here in Kansas City. I think personally there's going to be kind of a vaccinator fatigue syndrome set in. And as the months go by, it might be harder to get volunteers to do the vaccine events. And so that's why we're trying to build up a good cadre of volunteers right here in Kansas City.
Dr. Morris, as you've gone through this, that's a great description. How has it been to travel internationally for your team?
Well, you have to continually watch the CDC and the State Department guidelines. Some places you cannot travel to. They may have great need, but you just can't get in there. Other places you can. But travel internationally is actually easier than everybody thinks. for the most part, there are ways to get most of the places you want to go. And we have not had difficulty getting our volunteers internationally.
Good thing.
Peg wants to know, does COVID Care Force coordinate with the Medical Reserve Corps of Kansas City?
We coordinate on the ground wherever we are. Now, here in Kansas City, we're working with the local health departments, and they are working, of course, with communities, the city manager and the city staff, or if they're holding the event, in some cases the fire departments are holding the event. So we are coordinating. And then within our Indian reservations, we have worked side by side with the Medical Reserve Corps, and they have been an important part of the response in the Indian reservations. Very important.
Susan wants to know, are there any walk-in clinics for COVID vaccination in the KC metro area?
I'm going to have to defer to Dr. Stiles and Dr. Hawkinson.
Yeah, Truman Medical Center said some walk-in clinics, and after that, I think some of the health departments are walk-in clinics, but
Yeah.
I'll have to verify that.
Yeah,
Do you know?
I thought maybe some of the health departments.
Yeah, I know we are not. The other thing you can do is some of the pharmacies. Often, everybody's got extra doses right now,
Yep.
and so if you walk into a pharmacy, there's a great chance you're going to be able to get vaccinated.
Yeah, and even scheduling may be same-day scheduling. And again,
Yeah.
I think it's going to change soon, because I think soon the health systems, the private clinics, are going to be able to order vaccine themselves. Right now, I believe the vaccines, unless it's those private pharmacies, the vaccines for, say, hospitals, say for University of Kansas Health System, are still coming through the health departments, the county health departments.
Yeah, and so the question for us is one of the logistics.
Yep.
You never want to waste vaccine, although right now we've got extra vaccine, but you don't want to waste it. And so because it's got to be cold storage, you have to warm it, then you have to get it mixed up and use it, and you have a certain number of hours to use it. So when you have a mass vaccination clinic, you've got it all focused right there. Otherwise, you're trying to distribute it all across all your different clinical sites. We have 100 different clinical sites, and so it's hard to get it distributed and then used and make sure that you stay, in front of the need.
Yeah.
So there's just a logistical challenge. I think we're going to be able to work through that, where we spend a lot of time trying to model that. I think it's going to hit our primary care clinics first, and some other places are trying to do the same thing. That's going to be. I think that's incredibly important. And I want to ask you, Dr. Marsh. I want to return to this topic with Hawkeye and I, but first with you. What have you seen that has been the most effective way to address vaccine hesitancy?
That's a great question, and a lot of people are studying it because it's an important thing. I think, first of all, by getting the vaccine yourself and being an example and letting people know, and there's this new term called the vaccine selfie. Everybody's taking pictures of themselves, but you want to let people know, hey, I did this, and then pay attention to the science. But a lot of people just, they've already got their mind made up. But I think, as we just talked about it, yeah, did I have some side effects when I got my vaccine? Sure, I got a little bit, but it wasn't bad. So I want to say, and I use my Facebook posts and all that, I've been doing this since COVID began, just speak up. Speak up. Be an advocate for vaccines. If you have friends that are hesitant, just encourage them. Tell the story about, think about the common good like we've talked about today. Go ahead and be willing to sacrifice. I mean, just think when polio came out, the polio vaccine, everyone just stood in line, and I got my little sugar cube and the little pink stuff, and they told me.
Ourselves, Dr. Marsh.
I know. But they told us, some of you are going to get polio, get a mild case of polio. This is a live virus. And it's like, well, we did it because it was the right thing to do. So I think just being a good example and trying to beat that drum, just keep talking about it.
Hawkeye, we've talked a little bit about it. We've got to have patients talking to their physicians, because I think that's the most important relationship for getting people to have a vaccine.
Yeah, yeah, certainly. Trusted physicians, people they're seeing in their medical team. It is very important. We've continued to tout how coming to the health clinics now are safe, all the protocols, but have those hard conversations with your physician or your medical team, because they are going to be the best resource. So hopefully people can get out and have those individual conversations, because I think that does go a long way for sure.
I think that people have a little bit of fear still. So my guess is that, we have 50% of Americans have had one vaccination, and there's, a significant number of kids that have not. And I think that'll change the numbers a lot once we get that going. And I think that's going to be going starting this summer, I hope, with the data coming out from Pfizer and Moderna. But I think that it's going to be incremental change after that. I think here are the increments that I hope are going to change it. But unfortunately, it's a 6-month timeline, right? I think one of the increments is when the FDA switches from an EUA to an FDA-approved drug from Pfizer and Moderna. I think that'll happen. What I'm hearing is Pfizer, at least, is hoping to go in the fall. And so if that's true, if we can get those drugs approved by the FDA, I think that's going to help everything. That's going to make some people feel comfortable. That's an incremental change. I think getting kids approved for the virus, that's going to be an incremental change. I think that eventually, as this becomes more standard of care, it's standard of care now from our standpoint, but when it's approved by the FDA and others, I think you're going to see many places required to go to work. And I think if that happens, that's another incremental change. So I think that a year from now, we'll be sitting in a much different spot. But here's the problem. The problem is, in that ensuing year, between now and whatever that happens to be, in that ensuing year, this virus can continue to mutate every time it finds somebody it can be infected in. When you've been vaccinated, the ability of the virus to reproduce is extremely limited. And as a result, it's much less likely to mutate because the virus mutates when it begins to reproduce. So Hawkeye, we need the vaccine to blunt the virus mutation to make sure the vaccines continue to work. In other words, this becomes, as you've said, we the people. This is what we've talked about before. The Constitution of the United States does not start with the preamble being, I, the one, have the right to do whatever the heck I want. It does not say that. It says, we the people of the United States of America, in order to perform a more perfect union, establish justice, ensure domestic tranquility, provide for the common defense, promote the general welfare. That means we, not I.
Yeah, but there's so many reasons as to why, just as you said, the Navajo Nation, they understand it's a full culture. We know that countries in Asia, they have a culture of the collective, of the good of the whole country, the whole collective, the good of the Navajo Nation. We need to get that or get back to that. There are still people who don't even believe that there is still an actual pandemic going on. And that COVID-19 is real, and there's a real virus and these issues. So there are a lot of issues there, but it is for the collective good, but also individually, especially if you are, say, over 50, over 60, you have a high risk of having significant outcomes that are severe, also long haul symptoms. But we know these vaccines can significantly reduce all of those risks. And so it's an individual, but also it's a collective good for the community as well.
Isaac has to have his wisdom teeth pulled, and he wants to know if the anesthetic that they will use will impact the efficiency or efficacy of the vaccine.
Go get vaccinated, won't have an effect.
No.
Sue wants to know, can you please describe the population that remains unvaccinated?
Yes. Here's what we know. We know that vaccine uptake has been slower in red states than blue states. We know that obviously there's a large proportion of children, and then there's a large proportion of people in underserved areas and especially in communities of color where there has been issues of medical experimentation in the past and a lack of trust. Also in rural communities for some of the same reasons, a little bit of a lack of trust. And I think that's the demographics that I'm aware of. We can get more specific by age group, Hawkeye.
I mean, the largest ones I've seen are certainly some of those, like I said, red counties. More, and you see these articles all over and surveys, but also it is the communities of color. I had a conversation with one of our environmental services workers yesterday. Nice lady upstairs on the 6th floor, and she still has not gotten her vaccination because she didn't know. She was fearful of it, and we had a good heart-to-heart conversation. At the end of it, she said she was going to get it. She is able. So in her duties, she does walk through the ICUs and all that. And I said, you don't want to end up like those people that you see in the ICUs. So, it is varying. But I think the largest amounts are the minority populations which have been hit so hard, but also some of those red counties, just as you mentioned. And again, that's just because those are the articles and the stories and the surveys that we have seen in the mainstream media.
Dr. Marsh, thoughts that you might have about that very question. Do you know about some of the communities and some of the areas that have been vaccine hesitant in the United States?
Well, I mean, I hate to say it, you know, our public health officials, starting at the top, did not always try to set a good example of wearing masks or following, you know, science. And, you know, I mean, it's really been a disaster. The pandemic was a disaster enough, but the way it was handled early on was a disaster as well. But fortunately, we are coming around and realizing, you know, people are getting vaccinated, and they're getting freer, and they're out, and they're, you know, no one's died of the vaccine, and you know, the chance, you know, the risk with a vaccine are just infinitesimally small. So you know, I think it's changing, and our leaders now, I think, knowing that there are certain populations, counties, and you know, let's go into those. Let's address those. Let's try to get them the education and get people that will talk to them, like you say, their primary care physician or provider, or family, get them to speak out and reach out, and that's what I'm trying to do. I'm trying to talk to as many people as I can to encourage them to get the vaccine.
And I think in the research we've seen, the most important relationship for vaccination is the relationship between a patient and their physician. And sometimes it wins. I mean, I had a patient yesterday. I worked really hard into practice to try and convince this person to be vaccinated. And you know, they just had a lot of reasons. And altogether, you'd put them together and you'd say, well, that's vaccine hesitancy. And a good person, and a really good person, and a great sense of humor, but just wasn't quite ready to be vaccinated yet. And I think that people are still a little afraid of the idea that it's a new thing, not an old thing, or that we don't know all that we can about the vaccine. And then I think some stories come out about the AstraZeneca vaccine or the J&J vaccine. And even though they are so much safer than most of the medications you take, if you looked at the side effect profile for penicillin, you would say, what a dangerous drug. I'll never take that. Whereas compared to the vaccination, if it's 1 in a million on the J&J, that is so darn low. Exactly. And the problem is that so many people have had COVID. Interesting article today also popped up that in New York last spring, not now because it'd be higher now, but last spring, 25% of the people in New York City got COVID.
It was unbelievable. I was there in April, but you know, it's a new day. And thank God for science, modern science, that developed these vaccines so quickly and so efficiently. And as you said, that's a great analogy about penicillin. People have penicillin allergies and have a complete, reaction.
You can have high risk and die.
And you can die. Yeah,
I mean,
people have died.
It's much more common, people, than it is with vaccination.
Yeah, I never really thought about that. And yeah, we'll take penicillin like it's a vitamin.
Like
or
it's candy. Oh, doctor, I need some of that antibiotic. Just fill me up with that antibiotic. They're like, no, wait, you don't have it. But I can't get a vaccine. Wait, do you understand what we're saying here? I mean, even things like remdesivir, steroids for COVID-19, anticoagulation for COVID-19, far more risky than it is with vaccination, Hawkeye.
Yeah, Z-Packs, people want Z-Packs all the time,
it's like
understanding.
candy.
You know, your risk of complications with those types of things. Nobody wants C. diff diarrhea. That is a complication of most all of the antibiotics, and it's actually, pretty risky as well. So, but there's different reasons for vaccine hesitancy, but we just want, the people, our patients, to be consistent in their thinking. They don't want the vaccination, but yet they'll want all these other treatments. Chemotherapy for cancer, that has a high risk of, number one, continuing to knock out your immune system, but also possibly leading to secondary cancer. So, just be consistent in your thinking and not wanting one because of this, but you're willing to get all these other things that carry higher risk. Just understand those types of things. And, like you said, it's a new day. We'll keep continuing to give our message.
You know what I'm thinking? I'm thinking people need to be a superhero. We talked about that before. Be a superhero. Do the V. That's our new term. We're going to start talking about that. Do the V, people. Do the V.
Questions? Don't do that in England.
I like that.
What does that mean in England?
It's bad.
Is it bad?
Yeah.
Oh,
You
is
know,
that that
you
wanker
being
thing?
the Star
Yeah.
Trek fan,
I know.
isn't this the Star Trek?
Live
That's
long
the
and
big-
do that
prosper,
one.
that's right.
I think
Do the
that's
V,
okay.
live
Yeah,
long and
that's-
prosper.
that's-
Do the V.
There you go.
3 Star Trek references in once, and I didn't initiate it. Let's talk about that. Do the V.
Diana has a really interesting question. Early on, she writes, it seemed long haul only happened to those who got seriously ill. But now we know that long haul can happen to people with mild or no symptoms. Her question, does that mean that vaccinated people who get breakthrough infection could still end up with long haul syndrome?
Vaccinated people who get breakthrough infections. Yeah, that's a great question. I don't know for sure that we
don't
know
know.
the answer to that question, Hawkeye. What we do know is there's some early evidence that suggests vaccination can help ease the symptoms of
Yeah, yeah.
long haul syndrome.
Yeah. Yeah, I mean, that's a good question. I don't think we know that yet. We would hope that if you did, again, even that spectrum of long haul disease would be low. But hopefully these are the types of questions that will be investigated. Again, we have seen those anecdotal and mainstream media articles about people who have felt better after the vaccine with long haul symptoms. No specific medical peer-reviewed publications yet, but hopefully those will come out as well. And if you are having long haul symptoms and you get the vaccine, I hope it makes you feel better. And maybe that is one more reason for those vaccine hesitant people to go ahead and get
Right.
vaccinated.
Well, I think the thing we do know is if you get vaccinated, you have much less likely, the chance of getting
Yeah.
COVID is like just drops
Yeah.
to the, and
95,
that means
yeah, so much.
you're not going to get long, you get long haul because you get COVID.
Right.
Even if it's an asymptomatic.
That's exactly
asymptomatic
right,
case.
because
So-
it looks like there's a secondary round of inflammation and other problems that can cause
Yeah.
some issues. And with vaccination, that doesn't appear to be the case.
Yeah, and so
Well, I guess-
also, there's a theory out there that maybe with vaccination, it helps kind of reset some of that continued inflammatory process or some of that mechanism that is continuing to cause those long haul symptoms. Again, an unanswered question, but it is being investigated.
So once again, live long and prosper.
Yeah,
Do the
that's right.
V.
Yeah, Glenn wrote yesterday or asked, was there a place where you could track publicly the breakthrough infection rate? And then we didn't get to his question. So he wrote today, he goes, it's 5,000 per 3 million. And he says that's 0.17%. And he just wanted you to speak to how rare it
Yeah.
is.
Yeah.
That was some of the initial.
Yeah, I don't think the numbers are great. That's what's
Yeah,
rare.
that was some of the initial
Data in the
data that the CDC had published after that first round of vaccination. So, we'll continue to look at that. We know that data is being collected. We know that the state health departments have put out information on how to track and identify breakthrough infection. We've had a number of patients here at the hospital who had initially we looked at for breakthrough, but they did not meet the criteria. So yes, that is something through the state health departments that is being looked at to collect all of that data.
Janet says that on the local news that they've been talking about how that we've had breakthrough patients admitted to the COVID floor. And she says, I think that's causing hesitation. Can you explain what's happening there?
Yeah, the numbers are incredibly few, and I promise you, we actually went through this data yesterday. I think there's one in the last several months. I mean, it just isn't very many, and most of the time it's somebody who's been vaccinated or who has other chronic illnesses and may not have as good immune response, and that's true not just locally, that's national data. So, are the vaccines perfect? No. Nothing is perfect in this world, people, but they are so much better than where we are right now, Hawkeye.
Yeah, and we should state that, the majority of those patients that we saw were actually asymptomatic. They were positive on an initial admission screen.
And you may still get it. It doesn't
Right.
mean you can't get it.
That's
It just means you're not
exactly
going to
right.
get sick. I think that's the key. And a lot of those patients, I mean, there's only been one person that we talked about yesterday who had who was positive and admitted for COVID reasons, and they weren't that sick.
Right.
So you just, and we've not had anybody in the ICU that I know of so far that has had vaccination, was all the way completed their vaccine 2 weeks after the second dose, or 2 weeks or 4 weeks out of their J&J dose, and then came into the ICU.
Yeah.
So again, it's incredibly effective, people. You got to quit looking for reasons to not take the vaccine.
Right.
That's just wrong. The reality is this is incredibly effective, and we've promised to you the entire time. We don't flapjack. We're not going to flap our arms and jack with the truth. We're just telling you the truth. There's a lot of stuff floating around on the internet. Most of it's false. make sure you listen to this.
Yeah.
Vaccines are safe. They clearly save lives, and they do reduce the toil and the harm from COVID-19 without question.
Mm-hmm.
Last question. Jennifer wants to know, she said, what do you know about the double mutant spreading through India and also a new variant identified in Texas, which has opened up, where they're completely opened up without masking?
Yeah. The problem is that the double variants just mean there's more than one variation, or they may have a variant that's incorporated. For example, you could have a South African and the British variant, or the Brazilian variant, all the same variant. I mean, there's all sorts of language around there, Hawkeye.
Yeah, I mean, the most recent one that I've heard about, that double variant, basically it's focusing on two mutations in that specific area of the spike protein that binds to the receptor. When those amino acids are changed, it causes a change. So that something like the bamlanivimab, that first Eli Lilly antibody, does not work appropriately. Those two mutations that they specifically talk about are one of the mutations is found in the California variant, the 452 variant, and then the other one is found in that South African. That's the second mutation. That's the 484. So that's basically what it is. It's unclear, how much further the other variants are, or any other mutations are in the rest of that spike protein. But that is mainly what it is. So I think we still need to look to see how efficacious our vaccines are against it. Again, these are in very specific parts of that spike protein, but there are still other parts of the spike protein through the vaccination that can cause an immune response and give you protection as well.
As well as T-cell response
that's
as well.
what that
So
is.
good stuff. Hey, listen up. Tomorrow, Dr. Rachel Leisman, the director of our microbiology in pathology, is going to be here to talk about our testing, along with Marissa Larson, the medical lab scientist. This is important because we're going to reach a milestone as a health system. We have completed 200,000 COVID-19 lab tests. That's a lot of tests, folks. But that is literally the tip of the iceberg when you consider that in the last year we did 4.2 million tests. Our lab has 350 professionals, 25 departments, operates every day of the week and every hour of the day. And gosh, they're in my office almost every other day saying, hey, we need more space, which they do. So we're going to be talking with them tomorrow. Actually, I think Dr. Wild will be back. Dr. Wild has a cold. He does not have COVID-19. He has the common cold. But if he can have a voice, he'll be here tomorrow. So it'll be a great conversation. Dr. Leisman's always a great person to talk with. Okay, final thoughts, sir. First of all, can I just say, what an honor it is to have you on the program. I don't know that you and I have ever had the chance to meet, which is unfortunate, because you have done some of the best work I know of here in Kansas City. Thank you for all the great work you've done with Heart to Heart, and now the COVID Care Force, and your new organization, Arm to Arm.
I like it.
But it's not bad. But I bet when you pick up the phone, people listen, and I think that's because of the credibility you've developed in this area of just trying to help people and do the right thing.
Well, thank you. It's a privilege to be here. And KU, we've had partnerships with KU over the years, KU Med and KU, the medical school. Heart to Heart has. We've gone around the world together and all that. And then I'm a patient of this institution. I had surgery here on January 21st.
Well, you look great, so
I feel great.
very
Yeah,
successful.
this is a great hospital. Everybody knows it, and so my congratulations to you. And then the vaccine program, I was a part of that. I was subject number 63 in the trial here. They've done a fantastic job. It's been we're all just working hard, and like I said, we're getting behind this. And so my last thing is, because you're the Star Wars guy, is
Star Trek. No, don't say that. It's Star Trek.
Star Trek. I'm so busy.
You can say, "May the Force be with you," too. I'm good about that.
Yeah,
But
may the COVID Care Force be with you.
That's right.
I
How
like
about
that, too.
So get vaccinated.
There you go. All right.
Okay.
Well, thanks again for being part of this our team today. I think you may have worked with Dr. Doug Girard a little bit along the way, too. So,
I have.
A good man.
Good
Yeah.
man.
Yeah, I couldn't say it any better. Get vaccinated. It's a new day. We will continue to give that messaging and keep everybody informed. Right now we know that these vaccines are safe. We are only giving the mRNA vaccines. Obviously, Johnson & Johnson has paused. We'll wait for new information on those. But right now, please make sure to come to the health system and sign up for your COVID vaccine. You can go using MyChart if you're a patient of the health system. Otherwise, go to kansashealthsystem.com/vaccine. If you can't get there on the internet, then please call 913-588-1227.
hey, to date, the health system has given over approximately 71,869 approximately COVID-19 vaccinations. We have 12,000 vaccine appointments available in clinic right now, people. We need your arm. So twist an arm. Let's do this arm to arm. Come on in. We have clinics 7 days a week. You can make an appointment 3 different ways. If you're a patient, use your MyChart. You can also call, if you're not a patient, you can call, or if you are one of our patients and don't want to do the internet, call 913-588-1227. That's 913-588-1227. Burn it into your brain, 913-588-1227. Or go to kansashealthsystem.com/vaccine in order to sign up. And gosh, that's important. In some ways, we are all volunteers in life.
Good.
And we are given a choice about what is the right thing to do, as people who volunteer and give their lives and give their hearts often do it. We hope that you do the best thing you can for everyone around you. Be a volunteer for everybody. Let's spread the story of how much safer vaccine can be. And remember, just as Captain Kirk would say, or Captain Burnham, or Captain Picard, or Captain Sisko, or any other, Captain Janeway, Captain Pike, or any of the other great Star Trek captains, they would look at you and they would say, in the Vulcan way, as Spock would, live long and prosper. And to do that, V for vaccination. Let's do this arm to arm.